Sawasdee krap, and good afternoon once again. We're back with the English language summary of the press briefing that we have, the live press briefing that we have here at the Center for COVID Situation Administration, or CCSA. And today is for Monday, the 13th of September, 2021. Thank you to Dr. Tuwisin, who gave us the Thai language briefing just now, recapping the most recent information and news. He ended with some very good points about the risk factors. The risk factors which we all should avoid. Firstly, risk factors regarding people. So if there are people who you have information that might be of risk of having contracted COVID-19 or having been in congested places, then that is one risk factor that you should most definitely avoid. So risk factors in terms of people. The second part is risk factors in terms of place or the venue. So if there are venues which are congested, venues which obviously have had a lot of people lining up or queuing up, or those who have been in contact with those in medical facilities or construction sites, of course the venue is an important factor in terms of avoiding these risks. So people, and then place or venue. And third, of course, is the risk factors in terms of the activities. That's quite obvious that certain activities may pose as a risk to infection of COVID-19 virus. So these are the very important risk factors that we have to avoid up to today. Now, today's briefing, I'll summarize the general situation and emphasize the measures adopted by the CCSA that was announced since the general meeting of the CCSA last Friday, which noted that the number of new cases and fatalities is now actually on a downward trend, as forecasted by the Ministry of Public Health in their simulation model. And towards the end of this briefing, I'll touch upon also the issue of the vaccine certificates. This was an inquiry on social media about vaccine certificates, the shots administered from abroad, from outside Thailand, in terms of the documentation and registration in the vaccine certificate issued by Thailand. So first, I'd like to emphasize first that to ensure that this downward trend of COVID-19 cases and COVID-19 fatality continues, this downward trend continues, that there will be a smooth transition towards the reopening of the country by the 1st of October. The CCSA has extended existing measures, as you know, for another 2 weeks, since last Friday, for another 2 weeks, which will be until the 30th of September. So in 2 more weeks, we still have the same type of measures that we have announced. So I'll go over some slides for you right now, coming up on screen. Some slides for you regarding just to recap the information that we announced last week. First slide you see on screen now is the COVID-19 zoning categories, which will be effective until the 30th of September 2021 in terms of the provincial distribution. So you can see your province where you live there on screen, and in what category it remains on until the end of this month. The other slides, for example, I'll be having a slide on the effective measures until the 30th of September 2021, and you see there a recap of that on screen right now. You can find this on the social media pages of the Public Relations Department and other channels as well, the official channels. Also, we have another chart regarding the measures for selected businesses, just recapping here in some bullet points. You can take some seconds to look at that. Also, we have information regarding the businesses that are not allowed to operate in shopping malls. So that's self-explanatory. As you know, the shopping malls are open now, and some businesses are still not allowed to operate particularly for health control reasons. This includes, as you see on screen, cinemas and movie theaters. However, the other types of business can open. And lastly, we have some information, an infographic here for you on the measures for schools, for school buildings in terms of their permission contingent to the approval of provincial education authorities. So that's a recap for you. And I'll move on to the vaccination progress now. The update on the number of vaccinations that we have administered since the start of our national vaccination drive. Yesterday, which was Sunday, we administered over 215,000 doses, as you see on screen. That's not a high number compared to other days because during the weekends we usually have a lower number. But if you notice, last week we had up to 800,000 or 900,000 doses of vaccines per day, and some of the days last week. Nevertheless, the accumulated number of vaccinations now in Thailand has reached over 40 million doses. That's a very good number, over 40 million doses, and this is indeed increasing. For yesterday in particular, when I mentioned over 215,000 doses, if you break that down, you can see on screen now, first dose over 109,000 and second dose over 106,000 with third doses there as well. Now, third doses, of course, is the booster dose, which is reserved for the medical personnel and frontline workers. Now, the aggregate total of those who have received the first dose now is over 27 million, while those who have received their second dose now stands at over 12 million. This number also includes, of course, the expat, the foreign nationals communities in Thailand. On the general situation, we have a number of new confirmed cases and new recoveries. Here on screen for you right now is the new confirmed case at 12,583 cases. However, for new recoveries, we have a much higher number now, which is 16,304. So new recoveries exceeding the new confirmed case for today, as in the many days past. In terms of the current cases, active cases still being treated in hospitals, we have, as you see on screen, over 132,000 cases in the green box on top there. Unfortunately, we have 132 fatalities, which is a lower number than the other days, but nevertheless, any fatality is a loss. 132 fatalities right now. So moving on to the cooperation that we receive from other countries. For example, the 300 oxygen concentrators from India and the COVID medicines from Germany. So just to share some good news on this regarding the continued support from our friends around the world. So firstly from India, on Friday, the 10th of September, last Friday, the country, Thailand, received 300 units of oxygen concentrators from India. This reflects the cordial and long-standing ties between the two countries, and of course the mutual determination to mitigate the impact of the pandemic. Now, this handover ceremony was attended by senior officials like the Deputy Minister of Public Health, the Ambassador of India to Thailand, and representatives of the Ministry of Foreign Affairs and the Royal Thai Navy. These oxygen concentrators will be dispatched to Busarakam Field Hospital and the public health service centers in Bangkok and surrounding provinces, including those administering patients under home isolation and community isolation. Also, earlier this morning, Thailand received 2,000 units of medicine, Casirivimab or Imdevimab, from the government of the Federal Republic of Germany for the more effective treatment of COVID-19. Now, this donation from Germany highlights the long-standing ties of friendship between the two countries, and we're very grateful for this kind gesture. Both thank you to India and thank you to Germany for their support to Thailand. Additionally, in terms of the vaccination, the plan for October is actually to inoculate at least 50% of the population in every single province of Thailand, with priority given to the elderly, those with the listed 7 underlying medical conditions, and of course pregnant women. Also, the eligible groups for vaccination have now been expanded to include children aged 12 years old and over in preparation for the start of the new academic year. So that is underway for the scheme for those aged 12 to 18, young people aged 12 to 18. Now we have some images there also just coming up. Yes, of course. Just to go back to the Germany part, yes, some images coming up here for the donation of medicines from Germany. You have there the German ambassador and representatives of the Ministry of Foreign Affairs and Public Health there. So thank you very much to Germany for that. Yes, so I'd like to move on to give some more information regarding the vaccines for those aged 12 to 18 that I mentioned just now. Just to stress that from the 21st of September onwards, the Bangkok Metropolitan Administration will give the first dose of Pfizer vaccine to students aged between 12 to 18 years old who are attending the 437 affiliated schools of the Bangkok Metropolitan Administration. And in this initial phase, the inoculations will be provided to students in high risk, meaning those with underlying diseases, children with developmental delays, as well as other disorders. And students who are prepared to be vaccinated should provide the medical records proving that they belong to the risk groups. And the BMA will also arrange public health units for vaccination and follow-up cases, as well as giving preparatory information before vaccination, including prevention and surveillance of disease in schools. Now, this is, of course, we're talking about for the scheme for the BMA schools in Bangkok, and for students who are in the high-risk groups. However, for students who are not in the high-risk groups, this is also underway. The registration via the various schools across the country, including international schools, has also begun for vaccination of students aged 12 to 18. And of course, when the vaccination process is complete, the appointment dates for the vaccination of our children will come to place. This includes also those not in the high-risk groups in due course. I'll move on to the reopening of the destinations. This will be information of interest to the English language community. Thailand plans to reopen 5 more destinations to vaccinated foreign tourists. This will be from the 1st of October onwards. So based on the success of the Phuket sandbox, the government has announced plans to reopen Bangkok, Chiang Mai, Chonburi, Phetchaburi, and Prachuap Khiri Khan provinces from the 1st of October as part of the second phase of the country's reopening timeline. This reopening will be launched alongside the newly adjusted Universal Prevention, if you recall, capital U, capital P, Universal Prevention Guidelines. This will be launched alongside these guidelines, under which all the 4 provinces and 1 city are in the process of preparation, including accelerating the vaccination of their local population and formalizing their tourism campaigns. Now, Thailand is also planning to boost domestic tourism by 2 stimulus campaigns. Firstly is Rao Tiu Doi Kan, and the second one is Tour Tiu Thai. Registration for these schemes is expected to open this month for the travel period from October onwards, which is the start of the high season of tourism in Thailand. Additionally, measures for business establishment and factories. Between the month of September to November, the Ministry of Industry is aiming to drive down the number of cases in industrial areas, factories, and business establishments. So if you recall, this sector, factories, and various business establishments across the country had been actually the focus of our efforts. They have been affected a lot by the pandemic in factories where construction workers have campsites as well. So this will be categorized into 3 groups, mainly number 1, factories, number 2, business establishments, and 3, construction campsites. And this will be implemented through the bubble and seal measures. And these measures will include the coaching and training, giving advice to ensure that factories fully understand how to implement the bubble and seal measures. So that's the aim until the month of October, looking forward to the month of November. That's what the Ministry of Industry is planning to do, to drive down these numbers as a priority. Now, just to share some information regarding the vaccine certificate from the information from the Department of Disease Control, as I mentioned during the beginning of this briefing, that there were some inquiries on social media. So this information, as you see on screen, provides guidance on how to obtain the vaccine certificate for international travel issued by Thailand. So you can see on the screen right now that you can apply for this certificate, of course, once you have the vaccinations. You can apply for these at three offices. So the first is the International Communicable Disease Control Port at Suvarnabhumi Airport. The second is the travel clinic at Bamrad Naradoon Infectious Disease Institute. And the third is the Urban Institute for Disease Prevention and Control. Now let me elaborate a little bit on this because there were inquiries on social media. Because of the lack or the absence of a globally recognized document in terms of recognition of vaccines, because of this absence, each country has come up with their own type of certificate or documentation which may be recognized within a region, for example, in the European Union or bilaterally. But of course, with the absence of a globally recognized one, many countries have come out with their own type of documentation. And may I say, not only countries, many states within countries have also done that as well. For example, some certificates are called digital certificates or digital green certificates. So each country has come out with their own because of the lack of international recognition of vaccines in terms of the documentation. But for travel, that should not be a problem. So therefore, since each country has issued their own, Thailand has also issued our own vaccination certificate, as you see on the screen there when I explained on how to acquire it. Now, please note that this vaccine certificate issued by Thailand can only be issued to those receiving vaccines from within Thailand. So those of you who have had your vaccine shots in Thailand, you can record it in this type of vaccine certificate document. For those who have received their vaccines from abroad, that was the question, you can use the vaccine certificate issued by the country that you have received the vaccine in addition to the other documents you have. So there's no need to put it in this type of document that is issued by Thailand, because this is particularly for those that have their vaccination inoculated in Thailand. So this might as well go for countries around the world as well, because of the documentation is not recognized globally yet. No document is recognized globally yet in that sense. So this is issued by the Thai government as a vaccine certificate for those who have been vaccinated in Thailand. And as I want to repeat, you can use your other documents when you have shots from abroad as the travel document in place of this type of certificate. It might be in the form of a paper. For us, it's in the form of a book, a white or a yellow book, which is easier to hold, easier to use when you travel, put it within your passport. But if you have had your shots abroad, you can use those certificates, those documentation for travel as well. I'd like to end with something about donating blood. Now, the Thai Red Cross Society has invited the public to donate blood, as we have heard for months now, because of the new wave of COVID-19 is making people donate less blood in Thailand. So blood supply actually in Thailand is in critical shortage nationwide. And of course, we invite our foreign friends, foreign nationals, expats to donate blood as well. Those foreign nationals who are interested may contact the National Blood Center, and you have the telephone number and the QR code on screen for you. And note that, of course, English is available. This contact number and QR code is for foreign nationals as well. Or contact any provincial hospital blood donation center for more information and for the requirements. And of course, due to the disease control measures, download the form for self-screening and assessment of risks of virus transmission. Do this first before going. The QR code is provided on screen right now. And in addition, those who wish to donate their blood may do so 14 days after being vaccinated. So only 14 days after you are vaccinated. So with that note, I thank you for your attention. Please continue to stay safe. Please continue to stay healthy. Of course, we're still on the same boat. We're still fighting this together. There's a downward trend. There are good prospects, good information that we see on a daily basis in the past weeks now, hoping that by the end of September, we will be able to solve the COVID situation to the best level that we can, and of course, open up the country and live life as normal. And meanwhile, please continue to take care of each other. Thank you very much, and then we'll see you again on Wednesday. Sawadee krap.